felt pain since high school, you said, but has it always been this pain that you felt, or is it the right-sided pain?
It's always been in the lower back.
But you don't know which...
I think it was like left and right. Just recently though, it's just primarily the right side though.
Okay.
Yeah.
Okay, but you don't remember, like, because you've had it for like a long time.
Yeah, I've had it for a while, so it's pretty much just been anywhere in the lower back, pretty much.
So just, it can switch. Does that ever go to the left side, though? That's
probably, if I remember correctly, it's mainly the right side. I don't think it's ever been the left side, though.
Okay, so it's been primarily the right side, okay. And really quick, when you do feel it, when you felt it in high school, was it kind of the same kind of intensity? Did it ever go down the leg when you felt it then?
Never down the leg.
Okay. And even right now, it doesn't go down the leg?
Even right now, it doesn't go down the leg.
Okay. But the 8 out of 10 pain that you were feeling, like really bad, was that more on the right side or just this one?
It's just like right in the middle, like where the spine is. Yeah.
Okay. Is this the worst it's ever been? Or?
This is the worst it's ever been in terms of like peak level pain, but in terms of like constant like dull aches and stuff, I've had it worse like in the past.
Do you know what activities aggravate it?
Like getting up off a chair, like those sudden movements.
That hurts, okay.
Yeah,
That's
bending my neck forward.
Okay.
When I go to the gym, like lifting weights, if I have bad form, obviously, that aggravates it, so things like that.
Okay.
I always thought my pains were like growing pains. Went to see a doctor, and they kind of thought it was abnormal that like someone so young had like consistent back pain.
Yeah.
So they obviously thought it was maybe some type of like autoimmune disorder, something along those lines. So they kind of sent me for an MRI for that.
Interesting, because autoimmune problems, they usually do a blood test for like rheumatoid factor.
Yes,
or...
I did.
Oh, they did? Okay.
I did also do those, yeah.
Was anything positive at all?
I tested negative for all of them,
Okay.
but they did say that in special cases you can still have an autoimmune disorder even if you do test negative.
Which is true, yeah, which is true, okay. And then so after they did the blood test, then they went to the MRI.
Exactly,
okay, okay. So this is the first x-ray you've seen?
Yeah, first x-ray of my like back and everything. Yeah.
Oh, interesting, okay. Well, my biggest thing that I'm kind of thinking about right now is whether or not we work on that right side first or we work on this first. So you're rotated out like this, right, which can pinch into that nerve on the right side.
Yeah.
But it's also torquing off your whole spine, right? So both can actually cause that problem when you look down. So go ahead and bend your head forward or down, and then that's when you feel it.
Yeah, it's like at the. I can still go pretty low, like at the peak of like, or like the minimum at which I can go down. There's like that pain.
Where?
Right here.
Got it. So right here.
Yep.
Okay. So the more and more you go down?
The sharper it gets.
Okay.
Yeah.
So check this out. Okay, so go ahead and do that. Go down one more time. So what I want you to do, and I want you to do this gently because it can aggravate something, but just go down one more time. But I want you to kick this leg out. Does that hurt too?
Still hurts a little, but hurts slightly less.
Slightly less? Okay. You feel in your lower back when I do that?
Just slightly.
Slightly? Okay. Let's go up like this. So just relax. Do you feel in your back when you do that?
I don't feel like that.
Okay.
Alright, let's go check here and see how things are going.
How about that?
Also don't feel anything there.
Good.
Did you have a crazy day, or was
It seems like it's
relatively
just
same?
a little bit more.
It was okay.
Good.
Yeah.
Not too bad, right?
Yeah, not too bad.
Good. Okay. Let me see the other side real quick, just to make sure. I doubt this is going to be bad.
Yeah, don't feel anything.
Good.
Bad.
It looks like it's just tethered from the top. Okay, so like I said, when you basically you bend your head forward, right? You already have this reverse curve, but when you bend your head down, that basically the only thing that's moving is basically your spinal cord. Your spinal cord is moving up along with your brainstem, and it's basically pulling onto that. When I'm saying tethered, it means that herniation, it can't move up, right? But it seems like it's not really taught down. And so sometimes when it bulges one direction, and it actually tethers down. So that's where people get sciatica or problems in one leg.
Yeah.
Yeah, so you don't have that, which is good. Yeah, so got something over here. Yeah, something's going on over here. It's even swelling. Okay, so as I go down, it's swollen over that side. It's actually swelling more on this side than on this side. Okay, so, question. Is that painful right here? Or tender, I mean?
Yeah, slightly.
Okay, sir?
Yeah.
Okay. here?
That feels fine.
Yeah. So that's what I was telling you, is the right side is more swollen. So you have some sort of liquid over here.
Okay.
Basically that's the swelling. Yeah, so if I push down here, it's like boggy here, but over here that's just the muscle. Right?
Okay.
So if I poke really hard over here, that doesn't hurt, right?
Yeah.
If I poke like hard over here, that hurts, right?
Yeah, it hurts more than one.
Yeah. Okay. You see how it's kind of tilted up like that? When that happens, a lot of times what happens is the bulge, or the disc, it's kind of like that. So if it's like that, right, it actually bulges out like that, so it swells up on that side.
I see.
Yeah. Fortunately, it's not impinging into a nerve that's going down over here, it's just swollen into that side. What's happened is it's more going backwards, that's why when you bend your head forward, it pulls into it, but it's not going out into these nerves. Yeah, the spinal nerves. Is that tender here? A little bit.
A little bit, yeah.
That's where I'm getting another reading over here. So I'll just show you real quick. It's really narrow back here.
Yeah.
You see that? So it's kind of pinching down into there, right? And so what's happened is, if this one is stuck in what's called an extension position, the rest of your neck actually folds forward like that, right?
Okay.
So what we're going to do is actually work on that as more of a primary spot. All these things, even if you feel pain here, a lot of times are secondary to what's going on over here. But if we can release that and can release that, I want to see how that does. What positions actually hurt it?
So if I like cross my legs like this and like kind of like go into like bad posture, I guess you could say.
What type of bad posture?
So like if I like lean back and kind of like hunch forward a bit, I think it causes like some pain.
Can you show me? Because I'm going to use that as a baseline, but also it helps me mechanically know that I'm on the right track. So just do that. So I'm going to actually look at your back while you do that.
Yeah, so like right here, I'll get some pain right here.
Okay. Just crossing your leg. Okay, just like that. You're
Yeah.
not even bending your head forward. Okay.
And yeah, generally if I just like stay within like this position and like move around, I'll feel like some pain.
Okay. That's pretty immediate.
Yeah.
Okay. So you have to be really careful at your desk.
Yeah, pretty much.
Okay. We're going to first adjust your C7, but I'll guide you through it. So what I'm going to do, and you're going to just kick your feet out. Yeah, there you go. Okay. So what we're going to do is we're going to give this a push forward, okay?
Okay.
So just relax here a little bit. I'm going to move this a little bit.
Hey, so, I think you were here yesterday, right?
Yeah.
Not too bad, right?
Yeah, that was okay.
Good. Okay.
I do.
So what I'm going to do here is adjust your L5, okay? That's specifically adjust, but eventually we're going to have to adjust your sacrum.
Okay.
So I'm going to roll you a little bit to me. I'm not going to let you fall off, okay? Just a little bit like this. I'm going to put my hip here so you don't go anywhere. What we're going to do is we're going to actually not just push it in to relieve some of that bulge, but we're also going to twist it over like that too, to reduce that right sided swelling too, okay?
Okay.
So I'm going to just have you just relax here, and then I have to feel where it feels a lot. That's good.
Okay.
Come on now. First time, huh?
Yeah.
So I just adjusted this. So it's not really one side. I can adjust it from either side, but I'm adjusting that joint and twisting that around. Yeah. So you absolutely are going to feel more, because that's the base. So you're going to feel more like you're kind of leaning over to that
Yeah,
side.
it feels like if I want to like balance like this way.
Yeah.
I know that's not straight.
Yeah.
In a way, it's kind of weird.
Yeah. So that's why I want you walking around a little bit, let your balance kind of settle into place.
It is not as sharp when I say less painful, so it's less sharp. And
It should be.
I think I can bend my neck more forward now, in a way.
Yeah.
Yeah, pain is definitely less. Pain is obviously still there, but it is less.
Good. Basically, it starts dissipating, but the ice will also help with that too. Right?
Okay.
If we restore good mechanics into that, that also helps a bit too. So as you walk around, what I want you doing is watch you walking around outside for like 5 to 10 minutes before you sit back into your car, just to dissipate that swelling even more.
Okay.
Yeah. So you'll notice that you start feeling better and better through it. Yeah.
Okay.
As the minutes progress.
Alright, sounds good.
We're gonna keep getting rid of that tethering that's happening because of that. Yeah. But you should get more and more range of motion as we adjust that precise area.